According to a large-scale study by UCLA, the 5.3 million cases of Alzheimer's are expected to triple over the next 40 years. The early warning signs can include memory loss, getting lost while taking a walk, and suddenly not being able to do things you always did, like balance your checkbook.
But could a new blood test detect this disease 20 or even 30 years before those first symptoms appear? Joining us now is Dr. Elroy Vojdani. He's a pioneer of functional medicine and blood testing. Welcome, doctor. We were so excited when we were talking about this in our meeting a couple of days ago when we heard that you were coming on. What is the blood test for Alzheimer's? How did you develop this?
First of all, thank you for having me. It's an exciting topic, and we're living in a really exciting time when it comes to managing diseases like Alzheimer's. We're understanding much more about this disease in the last 4 or 5 years than we have in maybe the 20 years before that. And it revolves around the development of a protein in the brain called amyloid beta. We're learning that this protein actually has a purpose in defending us from something. So the research was really dedicated to trying to understand what this protein is defending us from in our environment and how we can detect whether those things are going on in your system.
So this test gives you a picture of what's going on in the brain, and is what you were talking about, you know, if you have a family member that has Alzheimer's dementia, you always hear about plaque on the brain, right? Is that what you're speaking?
Exactly. Okay. This plaque is predominantly made of this protein amyloid beta. And you know, the real importance here is understanding that, yes, we're looking at tripling Alzheimer's in the next 40 years, but more importantly, today, we have 47 million Americans that have preclinical Alzheimer's or pre-Alzheimer's. That's almost 15% of our population. And as a clinician, we really don't have the tools ready for those people to say, okay, this might happen 20 or 30 years from now. What is going on right now that pushes you in that direction? So we wanted to develop a risk assessment tool, and that's what the research revolved around.
And is the idea that if you can identify it early enough, you can actually take some steps to do something about it?
Yeah, absolutely. There are clinical trials that have been done in 2015, a trial called the FINGER trial, which looked at lifestyle interventions for people at high risk for Alzheimer's and actually showed a 30% risk reduction in those patients, and it was only a 2-year trial. Wow. Now, let's talk about if we can intervene 20 or 30 years before that, I think we can have some really serious impacts.
And what would be the components of that, what I'll describe as prevention?
What we're looking at is different environmental factors and what the immune system is saying about how your body is reacting to those things. So for some people it's diet, for some people it's identifying that perhaps a certain food is not agreeing with your immune system, or a lot of the research looked into the connection between the gut and the brain, which is a very hot topic right now in medicine. So perhaps we need to do more for this person to take care of their gut. Dietary changes, exercise more, there's a lot that's involved, but it's all very individual.
Okay, so who's eligible for this test? Who are the ideal candidates?
Everybody with a brain is eligible.
No? Okay.
Well, that eliminates a couple of us. Kidding.
And well, okay, so you were talking about maybe if this were to detect, let's say you take the test and you look like somebody that in 20 years from now could possibly have Alzheimer's. Is there ever a chance that it could be wrong and somebody could have this fear or this concern and the test be incorrect?
Right, so there's no for sure with anything in the preclinical stage, right? When you come to a doctor's office and you get the news that you have prediabetes, for example.
Yeah.
It's saying that there's a very high likelihood that if you continue on the path that you're on, you could end up that way. Same with pre-Alzheimer's. There's no guarantee that if you continue living the way that you do, this is going to be happening.
Right.
But you want to do everything you can to avoid it.
We're running out of time, but we always hear about promising research, and then they tell us, you'll be able to do this in 10 or 15 or 20 years. Is this a test that we can get right now?
It's going to be available on March 19th.
Wow.
It can be ordered by any physician's office. So you can get this now. You can get this information. You know, the first batch will be ready to roll with results by April 1st.
Amazing.
Very good. Wow. To learn more about how to be proactive, about brain health, or Dr. Vojdani, you can go to regeneramedical.com. Is that correct?
That's correct.
Okay. Thank you again, doctor.
Thank you guys for having me.
Thanks a lot.